Hello, viewers and listeners. In observance of World Mental Health Day this weekend, on today's COVID-19 update, Minister of Health Dr. Frank Anthony discusses the importance of mental health and the progress Guyana has made in the healthcare sector.
Well, mental health continues to be a challenge in Guyana. It's one of those diseases that's sometimes very difficult to detect. And even when it's detected, there's a lot of stigma attached to it. So people don't want to readily talk about these conditions. We have been working on uh, doing more comprehensive programs as it relates to mental health. And one of the things that we've been working on is really to train physicians at the primary healthcare level so that they would be more sensitive in their recognition of mental health illnesses. As it is, there are lots of people who would probably come to our outpatient primary care outpatient clinics and they would go unrecognized for things like depression and so forth. So we want to get people better trained to recognize these conditions, and once they're able to do that, we'll then be able to catch these conditions, so to speak, much earlier, and hopefully we'll be able to take preventative action so that the conditions do not escalate. We know that a lot of people who are depressed can then go on to have suicidal thoughts and then eventually can commit suicide. And as you know, Guyana still remains one of those countries with high rates of suicide, and that's still an ongoing problem. In 2017, for example, the suicide rate was 24.6 per 100,000 population. And while these rates are a little bit lower than what it previously was, it is still relatively high. So suicide continues to be a challenge for us, and we have been working on trying to understand the risk factors for it and coming up with ways and means of how we can mitigate against suicide. To that end, we have started a partnership with Columbia University, and that partnership would see us doing a longitudinal study for about 5 years. We'll officially launch this study in November of this year, and that study is being funded by the NIH, that's the National Institute of Health in the US, and we have some of the world's best researchers from Columbia University who would be joining um, persons from the Ministry of Health here to do a complete study over the next 5 years about the risk factors relating to suicide. And while they're doing that, is to come up with programs of how we can mitigate against some of these factors. So that would be ongoing work, and we also plan to do some additional studies with the help of Columbia University. But this we would talk a little bit more maybe in a month or so, because we have several studies and programs that are lined up that would help us to improve mental health in Ghana.
Dr. Anthony says the recent WHO approval of the malaria vaccine is a step in the right direction.
As you know, malaria, especially falciparum malaria, has been responsible on an annual basis for close to 500,000 deaths. And among those deaths, you probably have every year about 360,000 children dying from falciparum malaria. So with this particular vaccine that they've developed, it is going to help to reduce the amount of deaths that we are seeing, and certainly it would help to improve conditions within those countries with high prevalences of malaria. So we are very hopeful. This particular vaccine, in many ways, represents a first because it's the first time that a vaccine against a parasitic disease have been developed and have been proven to be effective. So I think this is opening up avenues for more such developments, and we'll probably be able to see research going in the development of new types of vaccines against parasitic disease. So the research that was done for this one, I think people would be able to learn from it and extrapolate and see how they can apply it to other such parasitic disease. So it's a good thing, and I'm very confident that it would save a lot of lives.
The minister provided an update on the current COVID-19 vaccination numbers.
Well, as of yesterday, we've had 366,190 persons who received a first dose of their COVID-19 vaccine. That would now be about 71.4% of the adult population. We also had 220,017 persons who received their second dose vaccine. So that now put it at 42.9% of our adult population. And in terms of children, we've had 25,615 receiving their first dose Pfizer vaccine. That's now 35.1% of that age cohort. And 14,679 of them would have gotten their second dose. So that's now at 20.1% of that age cohort.
This has been today's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.